All right, Courtney, are you okay if I get us started?
Yep.
Awesome. Well, hello, everyone. My name is Katie Powell. I'm a well-being consultant here at Care First, and I'm so excited that you have joined us for this month's Wellness Wednesday webinar. As we approach the end of the year, we are continuing our focus on prevention and education of various chronic diseases. If you were here with us in September, you know we highlighted Prostate Cancer Awareness Month, and just last month we focused on breast cancer. This month, November, is Diabetes Prevention Month, and we are going to talk about all the nuances of diabetes. We'll touch on things such as signs, risk factors, lifestyle modifications, how to manage diabetes, and more. So it's going to be a very packed, full 45 minutes. I would love if you guys please join me in welcoming Courtney Saylor. She is a registered nurse and clinical advisor here at Care First. Courtney has extensive experience in care management and a deep commitment to improving health outcomes. Courtney brings a wealth of knowledge in the field of population health, and her work focuses on connecting clinical insights with practical strategies to support healthier communities. Today, Courtney will be presenting on diabetes Connecting the Dots, a session designed to explore the critical links between diabetes management, member engagement, and long-term health outcomes. So welcome, Courtney.
Hi. Running today's session, you guys take a look here at covering. This presentation is designed to give a clear understanding, starting with what it is, common signs and symptoms to watch out for. And then we'll go into some practical steps for prevention, followed by strategies for treatment and ongoing management. Finally, we'll highlight the resources available through Care First to support you and for those that have diabetes for your loved ones. By the end of this session, they'll have actionable knowledge to help better health and well-being. So tell us,
it sounds like your audio is out a little bit. Just wanted to let you know.
I'll try to troubleshoot that, but tell us, do you know somebody who has diabetes? Do you yourself or do you know somebody that has diabetes? All right, so we'll move into diabetes. Diabetes is a condition, it's an endocrine disorder. It affects how it turns food into energy. Normally, your pancreas makes a hormone called insulin, which helps move that sugar or glucose into the cell for energy. When you have diabetes, your body doesn't make enough insulin, or it can't use the insulin properly. So this leads to high blood sugar, which over time causes serious health problems like heart disease, kidney damage, and vision issues. Understanding diabetes and why it's important for early management and lifestyle changes can help prevent complications and improve your quality of life.
Hi, Courtney. Sorry to jump in again. A lot of folks in the chat are still saying the audio is really bad. Are you able to maybe move closer to the mic or adjust it at all?
Does it sound better?
I think it just keeps chopping you in and out.
Does this sound better if I?
Yeah. Oh, yes. So much better.
Much better.
Perfect.
All right.
Thanks,
Okay.
everybody.
There's 3 screens up here, so I'm trying. I pick a different one, and so now we're on the right track here. Okay, so there's different types of diabetes. Type 1, diabetes. This is an autoimmune condition. The immune system attacks and destroys insulin-producing cells in the pancreas. The body makes little to no insulin. And this is usually diagnosed early in life. This is sometimes what people refer to as juvenile diabetes. Type 2 diabetes, this is your most common type. This is where the body does not make enough insulin and or the cells do not respond properly to insulin. So this becomes insulin resistance. This is often linked to lifestyle factors and usually develops later in life. And then we have gestational diabetes. So during pregnancy, the placenta produces hormones that can interfere with the action of insulin. So when the body can't make enough insulin to overcome this resistance, blood sugar levels rise, resulting in gestational diabetes. Pre-diabetes. So this presentation here is not just for those that have diabetes. This is for everybody. What we're going to talk about right now is pre-diabetes. So this is a condition where your blood sugar levels are higher than normal, but not high enough to be classified as type 2 diabetes. It signals an increased risk for developing type 2 diabetes, of course, but even at this stage, there's damage to the heart, blood vessels, and kidneys, and it may already begin. Good news here is pre-diabetes is reversible. So with lifestyle changes like healthy eating, physical activity, and weight management, these can prevent the progression to type 2 diabetes. So there is something you can do about that. When looking at numbers here, the slide highlights those key statistics and insights that show just how widespread diabetes is. 29 million Americans have diagnosed diabetes, with an additional 8 million members who are 8 million people undiagnosed. So what does that look like as far as a population impact? 15% of US adults have diabetes. 25% of obese adults in America have diabetes. And looking at that pre-diabetic surge, 38% of Americans have pre-diabetes. This is where so many people fall and they just don't even know that they are at high risk of developing diabetes, that their glucose levels are higher than normal. Diabetes continues to increase, especially type 2 diabetes, which are driven by obesity and sedentary lifestyles. Even the youth impact. So type 2 diabetes, it's appearing more often in children and teens, which is linked to obesity. When you look at healthcare costs, diabetes accounts for over $400 billion annually in direct and indirect costs. So diabetes is one of your most expensive chronic conditions, driven by those complications, hospitalizations, and long-term care needs. Risk factors. Diabetes can affect anyone, but there are some risk factors that increase your chances of developing this. So understanding these risks can help you take steps to prevent that. Family history. If you have a parent or a sibling with type 2 diabetes, it significantly increases your risk. There is a genetic predisposition that plays a role in insulin resistance and glucose metabolism. There's also genetic factors that increase risk based on your ethnic background. So in certain ethnic groups, there's a higher risk for developing type 2 diabetes. Aging is associated with decreased insulin sensitivity and changes in body composition, so more fat, less muscle, which affect glucose control. So that risk starts to increase after the age of 35. And if you've had gestational diabetes, you're more likely to develop type 2 diabetes later in life. Some other risk factors, PCOS and diabetes are both endocrine disorders. PCOS is characterized by hormonal imbalances, which lead to insulin resistance and increases the risk of developing type 2 diabetes. Both of these conditions share similar metabolic pathways, and they're both linked to endocrine dysfunction. Non-alcoholic fatty liver disease. So type 2 diabetes and fatty liver disease commonly exist together. About 60% of diabetics also have a fatty liver disease. Not surprising there that non-alcoholic fatty liver disease, it really comes from diet. So when we talk about overweight and obesity, healthy food options, this is where you're gonna see some of that correlation as well. So overweight and obesity is one of your strongest risk factors, and we'll talk a little bit more about that next. But untreated hypertension, so high blood pressure often occurs alongside of insulin resistance and metabolic syndrome. Untreated hypertension increases the strain on the cardiovascular system, and it is linked to a higher risk of type 2 diabetes. Bottom line, there are multiple risk factors. Some you cannot change, but there's many that you can. And we're going to go through preventing diabetes, some of those signs and symptoms, and how to treat it. Weight and diabetes. So first, let's talk about how weight impacts your risk. So body mass index, this is your BMI. It's a key measure. So adults with a BMI of 25 or higher are considered overweight. That significantly raises the risk of developing type 2 diabetes. And for some ethnic groups, the threshold is even lower. So Asian Americans, their risk starts at 23, whereas Pacific Islanders, their risk starts at around 26. Waist size matters too. So a large waist circumference right in that middle area is linked to both diabetes and heart disease. So for men, that risk increases when the waist size is larger than 40 inches. And for women who are not pregnant, it's for more than 35 inches. Why does this matter? So excess weight and abdominal fat contributes to insulin resistance, which is a major driver of type 2 diabetes. But with those lifestyle changes, healthy eating, physical activity can make a big difference. So let's talk about some signs and symptoms of diabetes. Recognizing these early warning signals are crucial for timely diagnosis and management. Symptoms can range from subtle changes to more noticeable issues, and understanding them helps prevent complications. Signs and symptoms of diabetes. So diabetes develops gradually, and recognizing these are really important. So urinating often. High blood sugars cause the kidneys to work harder. This leads to more frequent urination. Feeling very thirsty. Increased urination can cause dehydration, making you feel thirsty. Feeling hungry, even when you're eating. The body uses glucose. It's not using it appropriately, so these cells are signaling hunger. Extreme fatigue, lack of energy. This is because glucose isn't entering those cells effectively. Blurry vision, high blood sugar can affect those lenses in the eyes. And slow to healing. So poor circulation and high sugar levels impair the healing. Weight loss, this is usually where we see type 1. So even though you're eating more, it's common in type 1 diabetics due to that lack of insulin. And then tingling or pain, typically in the feet, sometimes in your hands. It's a sign of nerve damage, which is often linked to type 2 diabetes. These symptoms can be subtle at first. If you notice these symptoms, it's important to get tested. So how often should you get tested for diabetes? We'll let you do your knowledge check here. All right, so the answer is every 3 years from the age of 40 to 70. Now, most people said every year annually. That's a great guess. If you have pre-diabetes, it is once a year. Yes, you are absolutely right. If you have gestational diabetes, typically it's every 3 years. If you're over the age of 35, getting it checked initially once. If it's normal, then you should be screened every 3 years. But if you do look like you're developing that pre-diabetes, that's where you're going to be tested once a year. We don't often recommend to be tested any sooner than every 3 months, just because you won't see that number change too much in the hemoglobin A1C test. So here for testing, if you scan this QR code here, this is the ADA risk test. It's a quick and easy way to check for your risk for developing type 2 diabetes. So if you have a moment, you can either just take the picture now and just let it load up on your phone and take the, oh, sorry, it says, can you post the survey a little bit longer? But if you can take a quick snapshot of it of your phone, let it load, and you can always take it again later if you can't take it right now. But your A1C test, this measures your average blood sugar. It really doesn't change much. It kind of measures it over, a 3-month period. No fasting is required. This is also known as a hemoglobin A1C test, if you see that. For blood sugar testing, there's fasting and random. So fasting is your overnight don't have anything to eat after midnight, and having your blood drawn in the morning. And your random one, this you can take at any time. Often you'll see it finger sticks. That's your random blood sugar test. For your glucose tolerance test, this measures your blood sugar before and after drinking a glucose solution. If you've ever had a child, more than likely you did this during your pregnancy time. So this is where, you know, it's really important to have that glucose testing done when you're pregnant as well, to see what your risk is for developing gestational diabetes. So while some factors like age and family history can't be changed, others can. Weight, diet, and physical activity, those are all within our control. Losing weight without relying on GLP-1 drugs. I know this is a hot topic, so I want to be able to talk about this one for a little bit of time here. So losing weight without relying on GLP-1 drugs, it involves adopting this holistic approach that emphasizes natural and sustainable lifestyle changes. One of the foundational steps is detoxifying the body, which helps eliminate toxins and supports overall metabolic health. This can be achieved through dietary adjustments, increased water intake, and the use of specific herbs and supplements. Key supplements that aid in metabolic support include magnesium. It helps regulate blood sugar and insulin levels. Apple cider vinegar, it's known for its appetite suppressing and fat burning properties. Vitamin D3, which plays a role in weight regulation and immune function. Green tea extract, which boosts metabolism and fat oxidation. And cinnamon, which stabilizes your blood sugar levels and reduces cravings. Another crucial component for focusing on is whole foods. So a diet that's rich in unprocessed foods, such as fruits and vegetables, whole grains, lean proteins, and healthy fats provide essential nutrients. Prioritizing protein is particularly important. It helps maintain that muscle mass, and it keeps you feeling fuller longer. So thereby reducing your overall calorie intake as well. Staying hydrated is equally vital. Drinking at least 8 ounces, 8 glasses of 8 ounces of water every day can enhance your metabolism. It helps control your appetite. And even consuming a glass of water before meals also reduces your hunger and prevents overeating. Portion control is another effective strategy here as well. So being mindful of your serving sizes and using those smaller plates can help manage your calorie intake without the feeling of deprivation. So this approach encourages healthier eating habits, supports gradual, sustainable weight loss. Regular exercise is really indispensable in this journey as well. So engaging in a mix of aerobic activities, walking, cycling, swimming, along with those strength training exercises, weightlifting, or body weight activities, those contribute to fat loss and muscle building. I would recommend to get at least 150 minutes of that moderate intensity exercising per week to improve your overall health and support. So, definitely get those 10K steps in if you can. If you're listening to this and you're trying to multitask, if you can, maybe jump on your walking pad at the same time while we're going through this presentation. That'll give you another 30 minutes. But certainly, integrating some of these natural strategies, detoxification, supplementation, whole foods, activity, you can achieve the weight loss effectively and sustainably without GLP-1 drugs. You have the power to change things. So diabetes prevention is possible. Your numbers can return to normal. Prediabetes does not have to turn into diabetes. With lifestyle changes, your blood sugar can improve. Increasing your daily physical activity. Like I said, 30 minutes of movement most days, walking, biking, and any activity, that's really going to be crucial to your journey here. Just a small amount of weight loss can make a big difference in lowering your risk. Focusing on those balanced meals, more fruits and vegetables, less processed foods. Managing stress and making sure you're sleeping. I'm sure we're all thinking that's not possible. It's not going to happen. But try those relaxation techniques. Try to get some of those things done that's stressing you out before you go to sleep. If you're stressed out, you're not going to sleep. If you're not asleep, you're going to be stressed out. So really try to manage some of that stress to ensure that you're getting the sleep that you need. But these small steps really add up. So just start with one change and build from there. Staying active, physical activity is one of the most powerful tools that you have for preventing and managing diabetes, as well as other chronic conditions. So exercise controls your blood sugar levels. Your body uses energy more effectively. It lowers your blood sugar. It improves insulin function. So regular activity makes your insulin work better, reduces that resistance, reduces your blood pressure. Exercise helps protect your heart. It lowers the strain on your cardiovascular system. It boosts good cholesterol, lowers your bad cholesterol, and it strengthens your overall your health and mobility. So you don't need a gym membership. You can walk, dance, garden, home workouts, all of those things count. Just aim for at least 30 minutes most days if you can. Diet is an important factor to regulate your blood sugar control and to help you feel your best. So there is no one size fits all. The goal is balance and consistency. So eating a variety of foods. So include those different colors and types for nutrients. Monitor your portion sizes. Even healthy foods can raise your blood sugar if the portions are too large. Space your meals evenly, avoid those long gaps between meals to keep your blood sugar stable, and don't skip meals. So skipping meals can lead to spikes and crashes in your blood sugar. If you've gone way too long without eating and all of a sudden you're starving, you're just going to start trying to eat anything that you possibly can. You're going to be in the pantry versus being in the refrigerator, and then you'll be rushed to get to the next thing. So try not to skip those meals. And some foods to focus on: fruits and vegetables, your whole grains. This is your brown rice, your whole wheat breads, your pastas, your quinoa, non-fat dairy, so your non-fat yogurts, or trying to move to a skim milk versus a whole milk. For any meat substitutes, lean protein options. So that's the biggest one that I love. Is edamame. It's great with protein. You can have it as a snack. You can throw it in salads. You can just grab the bag and steam it in the microwave and then just go at it. I love having edamame anytime. But some of those small and consistent changes in eating habits can make a big difference in preventing and managing your diabetes. Dunkin', who doesn't love their Dunkin', right? I love my coffee in the morning, but I noticed that there's a lot of sugar in these drinks. So small changes in your drink choices and your flavoring can drastically reduce your sugar intake without sacrificing your taste. Just simple swaps and flavor adjustments can cut your sugar by more than 75%. For a fun fact, the large frozen pumpkin spice coffee has 156 grams of sugar, 156. That's like days worth of the amount of sugar that you should have. So that was really shocking to see that number. I know it's wild. So the less sugar that you start to consume, the less your body is going to crave over time. So instead of doing, your large pumpkin spice latte, swap it out for some of the unsweetened vanilla instead of that pumpkin swirl that has a lot of sugar. I did that, and just by doing that, it brought it all the way down to 30 grams of sugar. So just by switching out a little bit of that flavoring. And then even after that, I thought, okay, I still feel like 30 is a lot just for my coffee in the morning. So instead of having a latte, I did the same regimen and I just switched it with a hot coffee with cream. And that brought it down to 14 grams of sugar. So it is possible, you can do it. I still love my Dunkin'. And now I only have it with 14 grams of sugar instead of 71. All right, so let us know in the chat here, what do you prioritize most to keep your blood sugar steady? Is it your high fiber foods, your healthy fats? Is it your protein, or is it your whole grains over whites? Protein is my favorite. What I also do is habit stacking. So if I'm making coffee at home, what I'll do is I'll have my coffee with cream. I don't put any sweetener in there. But then what I do is I take my unflavored scoop of protein powder and put it in there. So I really like the collagen and protein, and I just go ahead and put it in there too. Yes, I love it. So if you have some great habit stacking, share it in the chat. I know it's really exciting. All right, so managing diabetes. It's more than just controlling your blood sugar. It's really a comprehensive approach that includes medication, lifestyle changes, and regular monitoring. So in this section here, I'm going to cover some key strategies for effective treatment and ongoing management to help prevent complications and really improve your quality of life. Diabetes complications develop gradually over time, so the longer your blood sugar remains uncontrolled, the higher your risk. High blood pressure damages blood vessels and organs throughout the body. It leads to serious health problems, coronary artery disease, chest pain, heart attack, and stroke. Nerve damage, excess sugar in those tiny little blood vessels that feed the nerves, especially in the legs. This is where you'll develop neuropathy. So again, if you do have diabetes, getting those regular foot checks, having the podiatrist clip your nails, because you can't always feel it. So sometimes, it's really good to be able to check your feet if you do have neuropathy that's developed from diabetes. Kidney damage. The kidneys, they have very, very tiny vessels. They filter all the waste through these little vessels, and diabetes damages these filters. Eye damage, blood vessels. Again, those tiny little vessels that are in the eyes, the high sugar damages those vessels, and it really can lead to vision loss, cataracts, glaucoma, blindness. So really important to also have your eyes checked. Gestational diabetes complications. So this really includes a big one, which is preeclampsia. So preeclampsia for the mother, low blood sugar for the baby, and a higher risk of developing type 2 diabetes later in life for the baby. But managing blood sugar, blood pressure, and cholesterol can really reduce these risks. Highs and lows. Managing your blood sugar is critical. These highs and lows can both cause serious problems. Both extremes are dangerous, so monitoring and quick action are key to staying safe. If your blood sugar is high, you're going to administer your insulin. You have fast-acting insulin most of the time. It's the most effective method to lowering the blood sugar levels. And then staying hydrated, engaging in that physical activity can maintain those levels to keep them from spiking. Low levels. Oftentimes this causes more immediate problems. So you'll start to feel confused, dizzy, sweating, and at some extremes, it's a hypoglycemic coma. So this is where you'll follow your 15-15 rule, 15 grams of a fast-acting carb, wait 15 minutes and check again. If you're going out of the country, learn to say, I have diabetes, or sugar or orange juice, please. I would learn how to say that, or at least write it down. So in the event that you do have a hypoglycemic event, that you can share that with people so they can help you. Diabetes doesn't just affect your physical health. It can significantly impact your mental health as well. This includes conditions like anxiety, depression, and often what's called diabetes distress. So people with diabetes are 2 to 3 times more likely to have depression than those that don't. But only 25 to 50% of those that have diabetes and depression actually receive a diagnosis and treatment. But managing a long-term condition like diabetes can be a major source of stress and anxiety. These numbers really highlight the importance here for mental health screening with people that have diabetes, and ensuring that you have appropriate access and support for treatment. So CareFirst offers several mental health resources that help you if you're dealing with diabetes, or if you have a family member that's dealing with it. So if you have anxiety, depression, diabetes-related stress, our behavioral health services, access to licensed therapists, psychologists, psychiatrists, both in person and virtually. Our Care First Wellbeing Program. We have tools for stress management, mindfulness, and emotional resilience, and our 24-hour nurse and behavioral health support line as well. Managing diabetes often requires medications to help control your blood sugar levels. There are three main categories of medications that are commonly used. Number one is insulin. It's essential for people with type 1 diabetes. They need it to survive. Their bodies don't produce enough insulin. Many people with type 2 diabetes or gestational diabetes also require insulin therapy. Insulin helps manage blood sugar and provides energy for the body. For type 2 diabetics, the first-line medication is usually metformin. You may recognize it as other brand names, but it works by improving how the body uses insulin and reducing the glucose production in the liver. And then your GLP-1 meds, these are your peptide hormone injections. They help control blood sugar by increasing insulin secretion and reducing that glucagon. It's also slow digestion and suppresses appetite signals, which can reduce the hunger and improve the feelings of fullness. These medications, they all work in different ways. The treatment plans are personalized based off the type of diabetes and your individual needs. So if you do have diabetes, speak with your provider and see what's available for you. Managing diabetes is not a short-term effect. It's a lifelong process that involves multiple factors working together. Effective management requires attention to several of these areas: monitoring your blood sugar regularly to stay within your target areas, your target ranges. Healthy eating focuses on balanced meals and portion control. Physical activity helps improve your insulin sensitivity and your overall health, and medications as prescribed to help control blood glucose levels. These are all really important for managing your diabetes and also your regular doctor's visits. So this is where your provider is going to help you with managing your progress and adjusting your treatment plans as needed. The goal here is to aim for diabetes control through consistent and coordinated efforts across all of these areas. So thank you for having me here today to talk about diabetes, covering those signs and symptoms, prevention strategies, and management approaches. I will turn it back over to Katie, who will share your Care First resources available to support you.
Actually, before we turn it over, do you mind if we have some questions?
Oh, yes.
All right. So someone has asked, I've seen glucose tablets and shots in the store. Are those really effective?
Yes. So oftentimes people take glucose tablets with them. It's part of having that safety net there available if you do experience lows. So I would definitely recommend that if you often have hypoglycemic events, to carry that with you.
Great. Have you heard cinnamon helps regulate sugar levels?
Yes, as I have heard that. Yes, that's why I put it here. Yes.
Someone also mentioned honey, I think, as a replacement in coffee.
It can be. Honey does have sugar in there, so you just have to be mindful of the amount of sugar that's in that. I would say raw honey is better than some of those other produced honeys that you might find in the store too.
Awesome. Lots of diet related questions. Any thoughts about oat milk or almond milk?
Absolutely. Yes. If it's got lower sugar, lower fat, lower sugar, there's so many different options that you can have. There's a wealth of resources out there that can help you with that. Again, some of our virtual programs that we have, our Care First resources, will help with that. And I know that with our well-being platform too, you can access some of those areas to help with your diet and your planning.
Awesome. We do have a question about at what daily number is a crisis and should you go to the hospital for help? I'm thinking they mean for low blood sugar.
Yes. So for low blood, yes, there are crisis numbers. I'm going to try to come back up here, see what I can see. If we go back up to our signs and symptoms here with the slide that has numbers for your highs and lows that they can access real quick and take a quick snapshot of that. Yep, so slide 26 right there. If your sugar is greater than 240, if your blood sugar is less than 70.
Yeah, and I think I've heard too, when it comes to low blood sugar, if you've tried the 15-15 rule twice and you're not bringing up your blood sugar, then that's when you would want to get help, whether it's calling a neighbor or something like that. I'm not sure if you have any thoughts on this, but someone is asking about FDA approved weight loss injections like Ozempic. Do they help with diabetes or lowering cholesterol?
It does help with diabetes, yeah. So those are your GLP-1 drugs. There are some other health benefits too related to the cardiac system as well. These GLP-1 drugs are very effective, but they're not covered necessarily by all plans. So I would talk with your provider to see if it's something that is appropriate for you, and then talk about your options with coverage.
Awesome. We've got a lot of good questions. People are asking for the presentation, which we'll absolutely send. Do we know of any vitamins or supplements that help with cortisol? I know that cortisol is a big factor with a lot of this, stress, etc.
Yes, cortisol level, that will affect your sleep for sure. So managing your stress is really important for that. I'm sure there's supplements that can help with your cortisol levels. But for today's presentation, just managing that to help with improving your diabetes and preventing pre-diabetes as well.
Awesome. Well, I think that's the majority of the questions. If we didn't get any, feel free to add some more. There will be a follow-up email that will have this presentation and the recording. So the last thing we want to talk about is the CareFirst resources that are available to you, which include, as always, our CareFirst Wellbeing platform. This is your go-to solution for everything wellness. Within our digital platform that can be accessed via the app or desktop, you have tailored and customized content, timeline feeds, you have tracking capabilities, you have the ability to participate in monthly ongoing challenges, as well as a unique health profile. In addition to that, the CareFirst Wellbeing does offer core programs. So everything from health coaching to weight management to financial well-being. We'll start with our weight management diabetes prevention program. So we offer two. We offer Noom and Eat Right Now. Noom is really designed to help you achieve that healthy weight and to maintain it. It has personalized psychology-based lessons that help you understand your patterns with food, why you eat, when you eat. The daily lessons are on your terms, so you can swipe and receive as much or as little content as you would like for the day. In addition, it has all those great tracking tools as far as tracking your food, your exercise and activity, working with a health coach, and more. I will say Noom is a little unique because it does have that psychology-based approach. So when you put in your foods, it does do that normal, breakdown of calories, fat, and carbs, but it also puts them in those different categories. So it's green, yellow, and orange. And the food is put in a color-coded category to indicate if it has most nutrients, most nutrient-dense foods, or least nutrition-dense foods. So that's kind of where that psychology-based approach comes in. Courtney said something really that kind of hit me, spend more time in the fridge than the pantry. And I just think that's such a great takeaway because a lot of your healthier foods are going to be found in the fridge, and that would correlate to green foods in Noom. I didn't mention this yet, but for both Noom and Eat Right Now, you do need to qualify for Qualifications include having an elevated BMI of 25 or greater, a pre-diabetes diagnosis, and there's a couple other qualifying for the program. So if you are interested to see if you qualify, you would go into CareFirst Wellbeing, navigate to the program section, and then click on the program you are interested in joining to see if you qualify. So the reason why we offer 2 different weight management and diabetes prevention programs is because we know everyone learns and receives information differently. And what works for one body may not work for everybody. So Eat Right Now is just another approach to weight management and diabetes prevention. It has ongoing modules. It is what we call a completer course. So you can essentially complete all of the modules and graduate. This is good for people that just want a jumpstart refresher of education and some help with things like mindfulness and understanding cravings. It does also have a flipped classroom approach. Sorry, it jumped in my mind, where you can drop into weekly classes and talk with an expert. We offer health coaching as well. So anyone that has CareFirst Wellbeing can qualify for our lifestyle management program. This is a telephonic program where you have a dedicated certified health coach and you can work on lifestyle like behavior change. So things like physical activity, stress management, weight management, and more. In condition management, you do have to qualify by having one of our 10 core chronic conditions seen here. It is telephonic again, and you do also get a dedicated health coach, but you are going to work with a registered nurse, and you're going to be able to dive deeper into the clinical aspect of your condition. So you can talk about things like medication management, your numbers, your recommendations from your doctors, and more. We also have a diabetes virtual care program that helps manage your diabetes and reach your goals. You can work with a dedicated care team and be provided all kinds of tracking tools, devices to monitor things like your blood glucose, as well as receive content and education, interactive lessons, and more. If you are a CareFirst member and 18 years of older, you have been diagnosed with type 2 diabetes, and you have an A1C level of 8% or greater, we encourage you to apply. You may also be reached out. We do some external where we call you and tell you about the program and invite you in as well. And that's a really good resource for our topic today. And I think last but not least is just more additional resources. So hopefully you can tell that at CareFirst, we really care about our members and we are trying to provide as much of a holistic approach to your health and well-being as possible. So if you want more information, we have a preventative care list. We have a full, robust health library, and we even have care management programs for more complex healthcare needs. Awesome. All right. I just think it's so hard to believe that we are already at the end of the year. I remember kicking this off in January. And now we're approaching the end of 2025 and we're preparing for the transition into January already. But first, in December, we are going to focus on strategies to maintain our financial strength throughout the holiday season. We have everything from gift giving to holiday dinners to traveling and seeing family. And honestly, this time of year just feels and can be more expensive, which also makes things a little bit more stressful. So come join us in December where we learn tips and tricks to save, earn, and thrive this holiday season, which will be a really great one. And then in January, we are going to focus on being the best you this new year. We will be diving deeper into winter wellness, which is hard to do, especially with daylight savings, but we can do it, focusing on physical health in the winter months, sticking to routines, and really just discussing the importance of the season, especially with seasonal affective disorder. So with that, we are ending right on the money. I want to thank Courtney for presenting a very robust overview of diabetes. And thank you all for attending. Make sure to look out for our email in the next couple of days or week, and we will send out the recording, the presentation, and just some supplemental information. Until next time, everyone, have a healthy day.